Hi, this is Dr. Sasse from Sasse Surgical. I just wanted to address a topic that's come up that's about staged bariatric surgery, or bariatric or metabolic surgery being done in stages as opposed to just at once. And what is this all about? Does it have any merit? Should I consider it? So how to address it. So if you hang in there till the end of this video, I'm going to tell you the 3 things that you should do to sort of pursue this and get the best possible answers and also the best possible result for you in your specific situation. So hang in there. So yes, there is a notion about staged bariatric surgery, and this is kind of a debate in our field, in the field of bariatric surgery worldwide. Should we do a procedure up front that is more aggressive but might possibly have the best long-term results in terms of reversing diabetes, reversing obesity, creating the best possible long-term weight loss? But should we do it if it has a little bit more side effects? What if it has more adverse effects or more risks down the road of things like vitamin or nutritional deficiencies or other potential side effects? So weighing those trade-offs has always been something of a consideration within bariatric surgery and in all fields of medicine. We're always trying to find the highest benefit, the greatest reward for the lowest risk for all of our patients, right? So one notion that has come along is that a procedure called duodenal switch, which consists of 2 parts. It consists of a stomach part where there is a stomach tissue removed, and a second part which involves a bypass procedure done at the duodenum, which is a little bit past the stomach. So these 2 are kind of considered links in a chain. They both go together. The notion of just doing the stomach part as a first stage gained ground about 15 years ago when the sleeve gastrectomy alone became a very popular procedure, and the data has shown that it's worked pretty well. However, for some people it's not enough. If they come in with a high BMI and type 2 diabetes, they may have the sleeve procedure and get partway to their goal but not all the way. So you come along for the second stage, which is to add the duodenal bypass portion, and now you have the duodenal switch. So the argument is, well, geez, if we were better at screening, maybe we should choose all of the high BMI people, all the high diabetes, all the people with more severe obesity disease, and do the bigger procedure with both elements right out of the gate, and we would perhaps get the best results. Possibly. This is a valid argument. Other people have suggested that, you know what, we actually get better, safer results if we do the sleeve procedure first, and then we wait at least a year and we see how do they do. Why? Why do they do that, and how does this work out? The reason is that we don't know how well a person is going to do after the sleeve procedure alone. Some people do amazing. They defy the odds. They lose every single excess body weight pound. They look like rock stars, and they're that way for a decade, and you just think, oh my gosh, this is the greatest surgery that's ever come along. But then another person may not lose enough weight. Their BMI may go down 10 full points, but they still technically have morbid obesity. They may even still have type 2 diabetes that did not get reversed. And so while it did them some good, it didn't do them enough good, and then we would come in for the second stage procedure and do the duodenal switch at a point at which they had already lost significant weight, and so the second step is easier to perform, it's safer, it's simpler at that time. And globally speaking, by doing that for 1,000 people in stages, you perhaps only had to do the second stage in 20 people, or 20% of people. So overall, you've reduced the amount of surgery and the risks involved. So you can see why this is kind of a debated topic and why there's not a single perfect answer. Our practice has mostly embraced the idea that we do this in stages because we think that that makes the most sense. However, sometimes you run into obstacles where the insurance plans may not even understand this, and they don't necessarily support the idea of doing anything in stages. They may not support doing a second procedure for bariatric surgery. Other times, the person themselves, they don't really like the idea of doing surgery once, let alone twice, so that's understandable as well. So there are a number of considerations here, and it's something that you're going to want to read about and mull over. If you've already had bariatric surgery in the past and you're thinking about maybe a second stage procedure and is there one that I could have, the answer is normally yes, there is. And will it work? The answer there is normally yes also. The key is to get to that very experienced bariatric surgeon who has a lot of know-how and experience with all the different forms of bariatric surgery, and in particular revisional bariatric surgery, because that's kind of a special niche where not everyone has that needed wide range of expertise. So what are the 3 things that you can do to investigate and solve your current dilemma with respect to getting the best result and the best bariatric surgery? I would say Number one is research in your area who you think is the best and most experienced bariatric surgeon. If you are thinking about this in terms of a revisional procedure or second procedure, make sure you find someone who has that experience in bariatric revisional surgery that they can really bring to bear, and that is the person you want to call and see if you can get an appointment to really get the best opinion. You might need two opinions. The second thing that you can do is take good stock of where you stand right now. What is your height, weight, BMI? Good stock of whether you do or don't have type 2 diabetes. That might mean getting a test with the hemoglobin A1C updated. And then importantly too, what is your insurance going to cover? Sometimes they will have exclusions for this, and so you're going to need to find out if they're going to cover it, under what circumstances. That's really helpful information. And what resources you can bring if they won't cover it in order to get it done. I would say the third thing is to, if you're about to pursue bariatric and weight loss surgery, is to read everything you can about it. If this is a revisional procedure for you and you've had previous surgery, then I would recommend that you read a special report that I put together that's on revisionbariatric.com, www.revisionbariatric.com. It's a free special report. It'll get emailed to you as a PDF, and that's just something that you can read that'll kind of make you very informed as you sort of mull over what your options are. If this is a first-time bariatric surgery consideration, then of course there's many places where you can get good information. Obviously, I think our sites are good for many articles that I've written, but there's a lot of good sources out there. You might consider the book Outpatient Weight Loss Surgery, and there's many other really good resources. But I would say read up a little bit so that you're sort of very versed in what you're about to embark upon. But keep hope. Have good hope, because today metabolic and bariatric surgery is better than it's ever been. This staged approach might very well be for you. You'll have to give it some consideration, and I hope what I've provided here is a good framework for you to sort of mull over and understand the debate as we see it. So best of luck to you, and I wish you great health.